Sorry. Thank you, everyone, for joining us today. We currently have about 48 people, so I'm going to give ourselves another minute because we had quite a few more registrants here. So this is the second in a series of webinars in which we're going to be looking at issues related to the provision of mental health services to people who are justice involved and what we can learn from different facets of our particular study. So as Ben has noted, we learned after the first webinar that quite a few people were interested in a copy of the webinar as well as listening to the recording because they weren't able to join us. So we will be posting that on our website, hopefully by tomorrow, but if not by tomorrow, the next day. And we will also be sending out a certificate of completion and an attendance badge for those folks who join us today. Okay, so I have with us today our team, actually a portion of our team. We have around 20 people who are actively involved in our particular study. This study is funded by the National Institute of Mental Health, which is part of the National Institute of Health, and my colleague Jennifer Johnson at MSU, Michigan State University, and myself, Faye Taxman from George Mason University, are the MPIs on this particular study. And we're quite, enthused by the work that we're doing here and everything we're learning thus far. Our study team also includes Jill Viglione, who's from the University of Central Florida, Niloofar Ramezani, who's from George Mason University, Alex Breno, also from George Mason University, Ben Mackey, and Tanisha Thurman, as well as a number of folks at the University of Central Florida, including Nick Paul and others. So, our presentation today is going to be led by Alex and Niloofar. And the focus of our discussion today is really about what can we learn from publicly available data sets. And we're using this as a way of helping you to think about some of the metrics that you would like to include, in terms of looking at your own county and jurisdiction. So with this, I'm going to turn this over to Alex. And Alex, you want to begin?
Yeah, thank you so much, Faye, for the wonderful introduction. And I also want to give a shout out to some of our partners. I know we mentioned them on our previous webinar as well, but I just want to give a big shout out to the CSG Justice Center, NACO, and APAF. So if we have any of those members on the call right now, please feel free to go ahead and give a nice little shout out. I don't know if I see any of them thus far, but
no, I don't think they're able to join today.
Okay, well then I just want to give them a quick shout out and then we can go ahead and get started. So we do have 3 goals for our presentation today. So the first one is to describe publicly available data sets that Faye just mentioned on county level characteristics that we discussed on our previous webinar on June 23rd, but we're going to go a little bit more in depth about where those sources are and then kind of talk about how we utilize some of that data in our study. The second is to discuss how that county level data can be used to identify patterns and trends in jail populations and mental health services. And then the last one is to identify the key factors that influence policy and practice and how those unique issues can influence reform efforts in the justice and mental health arenas within your given jurisdictions. So I just want to kind of start off by saying county level differences. We know that there are 3,100 counties within the US and they vary on population size, demographics, and location. Typically when we talk about certain issues, statistics are kind of shown at the national level and sometimes at the state level. So you'll hear things like 19% of US adults have a mental illness, or in 2019, 10.1 million people misuse opioids, or 8.3% of adults did not receive medical care due to the cost. But when we kind of take a look at that and look at county levels differences, you can really see a different story. So one example I want to talk about is on the right-hand side, these two maps, which are showing the same variable, which is the percent of people who are 12 or older reporting drug dependence. These two maps were created by an organization called Amphar, which is the American Foundation on AIDS Research, and they have some information on drug-related variables. And so what these two maps are showing is the top one is showing the state level, so this map in terms of drug dependence by the state level, and then the lower one is by the county level. And I know that we can, as you kind of look at these two maps, you can probably hone in on a lot of different differences across the two, but I just want to hone in on one real quick, and that's the state of Florida. So if you notice right here with the state of Florida, it's this light orange kind of color. And over here on this spectrum, it's kind of falling right in the middle, showing that they're kind of right about average in terms of drug dependence and the number of people who are dependent on drugs. But then when you actually look at it in terms of the county level, you can see a wide variation in terms of the counties within the state of Florida. If you notice up here around the panhandle, there's this dark red and dark orange colors showing the higher end of this spectrum. But then when you look at Central Florida and even in the South Florida, you're getting these lighter colors showing a lighter end of the spectrum, with the exceptions of Miami and Orlando right here. But you just kind of can see the vast difference between the different sections of Florida and how they kind of interact with each other. But then when you compile all of those together, it tells a very different story, saying that they're average. But when you actually open up the hood and look underneath, you can see that the changes actually vary greatly across the entire state. So the question then becomes, how do counties vary on a lot of these other factors and a lot of these other issues? And the answer to that question can actually may be able to help us understand how jails are actually being utilized across the country. So now I kind of want to bring it in terms of a context of our specific study. Excuse me. So 27% of those 3,100 counties, which is 848 counties, receive either CSAT, BJA, and/or NIH HEAL and/or JCOIN grant funds, and/or are involved in the Stepping Up initiative. And taking that last one as an example, 68% of those 848 counties participate in the Stepping Up initiative, which is led by the CSG Justice Center, NACO, and APAF, who were our partners. But all of these counties have the goal to reduce the number of individuals with mental illness in jails. So that Stepping Up initiative happens to be the most common initiative that these counties across the U.S. are involved in. And so if you look at this map on the right-hand side, the lighter green counties are the ones that are actually participating in the Stepping Up initiative. So in terms of our study, which is called the IM Justice Behavioral Health Study, we are looking to explore the Stepping Up counties in relation to what we're deeming as the other counties, which are the counties that are not participating in Stepping Up, and to how they can improve their local policies and practices. And more specifically, we want to know how these policies and practices affect the capacity to provide mental health services within your jurisdictions. And we kind of understand that different counties require different strategies to get to reform. And that's kind of the premise of this whole study, is we want to understand the issues and the things that your counties are going through that are leading to these decisions to participate or not participate into these reform efforts. So this is just giving us a pretty good roadmap for the rest of the presentation. They pretty much align with the goals that we have for today, but it is to look at the county level data resources that are publicly available. Then we're going to look at those county level, we're going to look at how county size affects those socio-demographic health and justice characteristics. Then we're going to look at what county characteristics are affected or affect a greater likelihood of participating in the Stepping Up initiative. And one thing I kind of want to emphasize is that the Stepping Up initiative is just one example of reform. There are a lot of different types of reform efforts that counties are participating in across the country, but we just kind of honed in on the Stepping Up initiative because it's the most common. So this is just one example, and then we're going to wrap it up with some final thoughts. So in terms of some county level data resources, the first one I want to hone in on is the County Health Rankings and Roadmaps, which is put together by the Robert Wood Johnson Foundation and the University of Wisconsin. The URL to their website is provided here. And this is a wonderful resource, and it actually provided the basis of our overarching database that we use for this study. So like I keep saying, like, this is all about county level data. And so because of that, this has county level data. Each row within this data set contains a state name and a county name, but then it also has something called a FIPS code, which is a 5-digit numerical code that identifies the county and the state, which is a great resource to use when you're trying to pool and merge information together from different data sources, which is what we did for our study. And the one great benefit to this data set is that they pool a lot of their information from numerous resources. So they take a lot of information from the census or other government agencies, and then they'll pull a lot of information from nationwide surveys, such as like the American Household Survey or the National Survey on Drug Use and things like that. And they pool all this information together. And this table that's on the right-hand side actually shows you a number of the variables that we pulled from this data set from the hundreds of variables that they actually provide. And you can see that they range from healthcare to criminal justice to other demographic type of variables. So as I continue to go through these slides, you can kind of see the tables on the right-hand side, and those are the kind of the variables that we ended up pulling from each of these data sources. So even though it's a great resource and has all these advantages, it does have a few disadvantages. Not all of this data is collected at the same time periods or it's collected annually. Some of them are every other year or every 5 years. So that's just a little caveat that sometimes you have to be wary of, is that you have to identify what year that data is from. So it could be from 2016 or 2018. And sometimes you just have to really specify, hey, that data that we use for this analysis is from this year. So that's one of the things that we ended up having to do as we were going to publish our manuscripts in certain settings. So the next one I want to talk about is from the Vera Institute, and this is their Incarceration Trends database. And this is, again, is another great county level data resource. And it has the jail population over time. So I believe they have jail information dating back for the last 50 years or so. And then they take this a step further and they even break the jail populations down by different demographic subgroups. So things like age, gender, or race. And it's a really great resource for you to use if you're trying to look at how jail populations kind of change over time or by different demographic groups. One of the disadvantages to this data set is that it doesn't contain this information for the different types of crime that these individuals were incarcerated for. It just has the overall jail populations. So that's just kind of one little facet that they don't go that specific with. And then another disadvantage is that sometimes some counties don't have a jail or they don't report having a jail population. And it's a little bit more difficult to kind of identify at times because sometimes they just leave it as blank in the data set, or they identify it as 0. And sometimes it's hard to tell if that means that they just don't have a jail population or they don't have a jail in the entirety of the county. The next one comes from the Uniform Crime Report, or the UCR. And this is the police employee data. And this data identifies all sworn and civilian officers for each county and city within the US. And this is a great resource if you're trying to understand or get a measure for a police presence within a jurisdiction. And that could be in relation to the population, or that could be in relationship to the overall square area of the county or area that you're looking at. The one kind of caveat to this is that the county and city police officers are held in different files and they're mutually exclusive. So you kind of have to do a little bit of cleaning and calculating to be able to combine them together to get one overarching count of police officers. But that's just one little disadvantage that's not too difficult to navigate around. And then the last data resource that we pulled information from is the American Foundation for AIDS Research, the Amphar. So this is the organization that provided those maps that I showed earlier. But this is a great resource because it compiles longitudinal drug-related data across a number of different variables. The only one caveat to this is that some of these variables are very specific to the certain types of drugs. So one of those examples being like the opioid death rate. It's very specific to the opioids. So if you're looking for the death rate for methamphetamines, it's not, this specific measure is not going to be able to answer that. But then some of these other variables are very more generic. So those maps that I showed previously was the percent that were drug dependent, or the percent of people that are dependent on any type of drug, is a very generic measure. It could be for marijuana or alcohol or any other types of drugs. So it's a bit more generic. So if you're looking for a more specific drug dependence for the different types of drugs, you're going to have to kind of look a little bit more in depth or kind of look elsewhere to get that information. So now that I've talked about all of these different types of data resources that we pulled information from, now I want to talk a little bit about how we selected the variables for our specific study. And this kind of took two different steps to it. So the first step was that the study team identified the variables that we believe were closely related both conceptually and theoretically, to our outcome variables. And what our outcome variables are jail population per capita, the mental health provider rate, and then participation in the Stepping Up initiative. And then from there, we use machine learning techniques such as random forest or Lasso, which are very helpful techniques at sorting variables by their level of importance. And what these machine learning techniques can do, which is a really great thing, is they can look at hundreds of variables and kind of really fine tune it and say, these are the variables that are most important or most relevant to you based on your outcome measures. And then this table at the bottom just kind of is a sneak peek that after these two, utilizing these two methods, these are the variables that we ended up identifying as the most important. But we'll kind of talk a little bit more in depth about that a little later on in the presentation. So now I'm going to start talking about a lot of these, a number of these variables and how county size can actually impact them. And so why county size? I mean, I keep talking about how county differences can really impact a lot of these variables. But when we look at county size, that's another thing that could really influence the varying degrees of these factors. So if we look at PA, for instance, which is where I'm from, you have 52 counties that are considered small in relative size in terms of their population. You have 12 that are considered medium size, and then you have 3 that are considered large size. So if we're looking at PA as a whole, they have a varying number of different county sizes across the state, but yet they all fall under the same state jurisdiction, which could influence some of these factors. So I'm just going to go through a couple of examples of some of these variables that we just talked about in terms of the county size and how they differ across. So the first two that we're going to look at is median household income, and then the percent that graduated from high school, or the graduation rate. And so what these graphs are showing is the density or the concentration of counties that are responding for each of these specific measures. So if we look over here on the left-hand side, this is the median household income. This blue curve is showing all the responses for the small counties. And so the higher up on the curve that it is, shows a higher concentration of counties responding for that specific value. So if we look here at this blue curve, right at the top, that peak, that's the most common median household income for small counties, which is right about 40,000. If we look at the green curve, which is the medium-sized counties, the most common response is 52,000. And then for the large counties, which is the red curve, their most common response is about 60,000. But if you can notice, the one thing to kind of notice is that the more area under these curves shows the higher concentration. So you want to look at this big area right here for the blue curve showing the small counties. This is where the majority of the counties are responding between. So that's right about a little bit more than 50,000, going down to about $25,000 per year as the median household income. But then when you look at medium and large counties, they're a little bit more spread out, showing a wider range of responses for their counties, and less of a concentration of a smaller area of responses. But the one thing to note on the median household income is this little red sliver right here, showing a higher concentration of larger counties reporting higher median household incomes. So as we see that as the county size increases, so does their median household income. But then when we look on the right-hand side over here, we can see from this graph that smaller counties actually have a higher graduation rate than the medium and larger counties do. And as we can see here, the green curve kind of being right in between the large counties and the smaller counties. So what we can kind of tell from these two graphs is that as county size increases, their median household income increases, but their graduation rate decreases. So now as we kind of go through more examples of some of these variables and looking at these graphics, I want you to think about would this be important? Why do we kind of want to understand this? And really what it boils down to is how are these variables going to relate to our outcome variables that I kind of talked about previously? That is the jail population, mental health infrastructure, and then participation in the jail and mental health reform effort. So kind of start to think about that as we continue to go through. So the next two variables that we're going to be talking about are kind of on the physical health side of things. So on the right-hand side, we have this graph that shows a number of physically unhealthy days in a given month. And this measure comes from a survey where individuals within the county were self-reporting how many days within a given month they felt physically unwell. And as what we can see from this graph is that there's a higher concentration of small counties reporting more mentally unhealthy days in a given month, which is pretty interesting to note when you look on the left-hand side, which is the number of doctors that they have in relation to their population size. You can see that the smaller counties, that blue curve, have a lot fewer doctors readily available in relation to the rest of their population size. And so smaller counties tend to be more physically unwell, but then they have less primary care physicians to kind of help them with those physical ailments. So it's just a very interesting relationship to see here, and one that we kind of have to start thinking about when we're kind of conceptualizing this mental health reform efforts and how physical health can actually be related to mental health. And that's kind of a nice transition to the next slide, showing the next two variables, which are the same kind of two metrics, but just on the mental health side of things rather than the physical health side of things. So we have the same question from the same survey, but instead of physical health this time, it's mental health. So how many mentally unhealthy days do these individuals self-report in a given month? And we can see the same story kind of unfolding. Smaller counties tend to report more mentally unwell days within a given month. But then on the left-hand side, you can see that they have fewer mental health providers to kind of help them with those mental unwellness. So like I said, it's a very similar story that we're seeing here, almost the exact same story. And we have to start thinking about the relationship between physical health and mental health when we're kind of bringing this in the scope of mental health reform efforts. So I want to kind of stop there for a second and see if there's any questions, either in the chat or the QA box. Ben, is there any questions that need to be answered before we move on?
Nope, Alex, no questions right now.
Awesome. Well, as we keep going, if you have any questions, please feel free to submit them either in the chat or the Q&A, and we'll make sure we get them addressed. So now we're going to move on to what kind of county characteristics impact a greater likelihood of participating in the Stepping Up initiative. And again, I just really want to emphasize that this is just one example of a reform effort that we just kind of honed in on in terms of the scope of this analysis. So I have this very similar graphs, which are kind of showing the exact same things that we show with the county size, but instead of looking at county size, we're now looking at participation in the Stepping Up initiative. And so the blue curves are showing the counties that participate in the Stepping Up initiative, and the red curves are showing the counties that do not participate in the Stepping Up initiatives, or as I'm going to call them, the other counties. And what we can see from the graph on the left, that Stepping Up counties tend to have a higher median household income than the other counties do. Similarly, they also have a higher concentration of mental health provider rates than other counties do. So they have a higher most common response, but then they also have a higher concentration the further up the spectrum you go. So more concentration of counties going up and higher than the other counties do. So this is a graph that's actually pretty interesting to look at, and kind of is a little complicated when we start to talk about it. So this graph actually shows the percent of drug treatment services that are paid by Medicaid. And as you can see from both the blue and the red curves, that there's these big peaks, and then it dips, and then it peaks again. And there's really no pattern here for both the Stepping Up categories and then the other categories. And so when we kind of took a look at this graph, we started to think, all right, well, why are we seeing this? So we ended up diving into this a bit more. And what we kind of noticed is that a lot of these counties, that this is heavily related to whether or not states expanded their Medicaid. So what we kind of noticed is that 91% of the counties that fell into this non-Medicaid expansion states are in this other group. So there's very few counties that are within these states right here that did not expand Medicaid that actually are participating in the Stepping Up initiative. But the one thing that kind of was very consistent across both of those groups is that counties that are in these non-Medicaid expansion states report mostly less than 15% of drug treatment services paid by Medicaid. So they kind of fall on this little area of the graph. So if you see that this peak right here, and then this little peak right here, this is due to these counties that fall within these states right here. So it's just kind of very interesting to see that even when we're looking at county level data, they are very much impacted by the state mandates and the state laws, that could be influencing mental health reform or health infrastructure and other things like that. So this is just a very interesting graph to kind of look at as we're kind of diving into what predicts or doesn't predict participation in a mental health reform effort. So the last two variables that I'm going to be talking about in terms of this Stepping Up initiative is in the criminal justice realm. So we have on the left violent crime rates, and what we can see from this graph is that Stepping Up counties actually have a higher violent crime rate than the other counties do. So there's a higher concentration of counties that report having more violent crime within their jurisdictions. But then if you look on the right-hand side, even though they have higher violent crime rates, they don't have a higher jail population in relation to the rest of their county population size. What we can actually see from this sliver of red right here is that there's a higher concentration of other counties that report having higher jail populations respective to the rest of their county population sizes. So this is another interesting relationship to see as we're starting to think about how some of these variables may relate to our outcomes, particularly the participating in the Stepping Up initiative, which is both a justice and mental health reform effort. But now what I'm going to do is I'm actually going to hand it off to my colleague Niloofar Ramezani, who's going to kind of go a little bit more in depth looking at some of these variables and how they predict participation in the Stepping Up initiative. So I'm going to go ahead and hand it on over to Niloofar, and you can take it away.
Thank you, Alex. So before I continue, I wanted to ask if there were any questions.
No questions right now.
Perfect. Great. So if we can move on to the next slide, I can start talking about what we did next. So different counties require different solutions to get to actually, to get to the reform, such as a Stepping Up, to customize different plans for counties regarding joining reforms like Stepping Up. We need to learn from different counties and understand counties' needs better. So we decided to explore what county characteristics may influence counties' decisions to join the reform. So within this national level study, we tried identifying predictors of US counties joining a national policy reform initiative to reduce the number of individuals with mental illness in jails. About 17% of counties, as Alex mentioned, have joined the Stepping Up so far, and the number is increasing. So different steps that we took in order to discover what county characteristics are playing an important role in this decision involved first consulting experts regarding the factors that may differentiate whether counties choose to participate in Stepping Up initiative or not. And then this way we narrowed down the number of factors that we were going to consider for these models. The next step, what we did, the factors chosen by the experts were entered into some machine learning methods in order to find both important and relevant variables, characteristics here. After we chose only the important and relevant variables, we entered those factors into some statistical models in order to figure out, okay, so which variables right now are the significant ones that are predicting the group membership of the counties and actually finding the likelihood of the counties joining reforms such as a Stepping Up. So as I mentioned, the first machine learning method that we used was random forest method. I am not going to bore you with all details of how these forests and trees work. What I'm going to do, I'm just going to tell you what it does. First, 34 variables from, like, they were the most potentially relevant variables selected by our expert. We entered them into the random forest model. So what they did their magic and they found, okay, what are the most important variables that are interacting with each other in order to predict the membership of the counties the best. So 22 predictors then were chosen as the most important factors there, along with 7 variables reflecting the jail population and mental health providers in the areas, which were the main 2 goals that Stepping Up is trying to achieve. The top most important variables, like 9 of them, I have put them right here for you. The green variables are the health and mental health related variables that were among the top most important factors. The blue variables are the criminal justice variables, and the yellow variables are the demographic factors. As you can see, county size that Alex was mentioning the importance of it and showed to you through those graphs how they are different was one of the most important variables here. Specifically, smaller counties we're showing a difference performance compared to the medium-sized and large counties. Average number of physically unhealthy days, how the residents of the counties were feeling regarding their physical health, how much primary care, like actually what was the rate of the primary care physicians in the counties, healthcare expenditures, as well as mental health provider rates and proportion of drug treatment paid by Medicaid. They were among the health-related factors that were important. From the criminal justice perspective, police per capita as well as per capita jail population, so the jail population concentration, they were the two important variables. And from the demographic perspective, besides county size, the proportion of the population of the county that were Black, that was another important variable. So the next step was Lasso. So what is Lasso? Lasso is a list absolute shrinkage and selection operator. It is a very helpful variable selection method, and it will enhance the accuracy of our prediction because we wanted to make sure that we are choosing only the variables that are the most relevant, they are not overlapping with each other. And this method right here selected 12 of the most relevant variables for us that could help us predict the likelihood of the counties participating in stepping up. I'm not going to bore you going over these variables, but as you can see, a lot of these variables are in common with what we presented before. And then we entered these variables into logistic regression methods next. So right here, as you can see, I have listed all of these important variables, health-related factors, criminal justice-related factors, as well as the demographic variables. So I'm just going to remind you of what the question was that we were trying to answer. We wanted to see what distinguishes counties that join stepping up and how do those characteristics affect the potential for policy reforms. As you can see right here, our results illustrated that county level healthcare delivery factors are major contributors to a county's likelihood or odds of engaging in stepping up reform efforts. Medium or large counties with higher mental health provider rates per capita, lower average number of physically unhealthy days reported by the residents within a given month, lower healthcare costs, higher percent of drug treatment paid by Medicaid, and the counties that have a medical school in them were among the most important health-related factors associated with higher likelihood of joining stepping up or being a stepping up county. Availability and access to medical and behavioral health care in the US counties may therefore facilitate efforts to address mass incarceration of individuals with mental health disorders. And finally, on this slide, what we tried to show you was what if we really want to just go for the most important factors right here for the smallest or most parsimonious model that we can fit, and what are the absolute most important factors there? Lower number of physically unhealthy days, lower healthcare expenditures, higher percent of drug treatment paid by Medicaid, higher rate of mental health provider rate. They were among the health-related factors that are absolutely important in this decision. And as you can see, smaller jail population, lower per capita rate of police officers, police concentration, and medium or large size counties, they were the factors that contributed into the higher chances of counties joining the stepping up. So final thoughts, here are a few final thoughts that we want to discuss. As we said earlier, 1 in 4 counties receive some sort of grant funding to improve behavioral health services. And therefore, you know, as we show from our models, counties with healthier populations, better public health infrastructure are more likely to participate in these efforts using stepping up as an example. But these are what we saw from our data. We believe that there might still be a lot unknown about like the factors that contribute into your decision and whether you are joining this effort or not, or some other efforts. So we want to learn about it. We want to learn from you about it. We want to know what issues are driving your decision for participating or not participating in efforts to improve service delivery in your counties. If you respond to the survey, your county help us better understand the specific issues of your county and how this may impact your policies and practices. With every response that you provide to those surveys, your county will receive a feedback report from us that will summarize your county's work and how you can utilize this information in your future efforts. Here is the final thought based on the results from our data, which of course we will add to it once we learn more about your counties. So the lesson we learned was, well, building community capacity for services of individuals with mental illness in the justice system can help reducing the demand on the justice system. Less populous counties, we saw they have greater need for increasing the amount of mental health infrastructure services, availability and accessibility of mental health services. More populous counties, larger counties, they have different needs that may affect funding services to help keeping mentally ill individuals out of the justice system. So please feel free to contact us at this email to see if you're part of this study. During our previous webinar, we had questions about whether you are part of the study or not. Please feel free to reach out to us. We also have a list on our website. If you receive an invitation to be part of this study, please complete the survey, tell us who, or if you're not the person who is actually in charge of those services, please let us know who else in your county is active in those efforts so we can reach out to them and learn more about your counties from them. And if you're asked to be interviewed, join us, tell us your story, and we can learn a lot from you. So I'm going to open the floor for questions. Thank you so much for listening to us. So if there are any questions, comments, concerns, suggestions, please let us know here.
So Alex and Niloofar, thank you for this great presentation and for also sharing some of the data. I guess I have one question. We're doing a study right now of trying to learn at the county level about planning issues, strategic issues, and implementation. From the variables that you sorted through, and you didn't mention, but in the machine learning techniques, part of the reason we did that is you had thousands of variables that we were trying to sort of pick through to see which ones were more important for most people in terms of having an impact on the size of their jail or in terms of mental health treatment capacity. But which of those variables would you recommend for the less populous counties to really think about, strategic planning around?
I would say that, of course, we're not actually providing a prescription for counties. They know their needs a lot better than us. But what we want to highlight is from all of those models, and we have fit like thousands of random forests, all of that we didn't bother you with trying to understand different counties' needs better. I would say trying to increase the mental health accessibility and availability. I know the budgets might be limited, but if there are some spending in that area, we saw that those factors were playing the most important role when it was coming to decreasing the jail population, as well as, addressing the needs of, people with behavioral health needs in the criminal justice system. So I would say mental health, accessibility and availability of mental health services.
Right. And so that, while, a lot of places recognize that, and obviously at the federal level, there's a recognition of the need for more mental health services. And right now, through some of the violence reduction, as well as the infrastructure, counties have the ability to actually access some additional funds to be able to expand community-based non-criminal justice effort. And I think at the time we're at right now, the findings from this particular work give us some leverage to really think about what's going on at the federal level for different types of infrastructure needs. And so I would encourage people to really contact your senators or your House of Representatives or at your state level to really talk about what's happening with some of those federally funded dollars. So I guess another question I have is, it doesn't make sense that violent crime rates did not appear to be a driver for jail populations. Can either Alex or Niloofar, can you explain that?
Well, explain in terms of why we didn't see that the crime rate might not have been significant. Is that your question?
Yeah, I mean, because logically people think you have crime in your community and that's going to contribute to larger use of a jail. But these findings suggest that it's not the crime as much, the volume of crime as much as it is an issue related to, what kind of other alternative services are available for people so they don't need to use the jail system as much.
If you want, I can go ahead and take a stab at this first. So the one thing that you really have to think about when we're talking about the analysis that we did is when you put these variables into these logistic regression models, and I'm assuming it's probably even the same with this machine learning techniques, everything is in relation to each other. And so when you put violent crime in with a lot of these public health or mental health service factors, it's just being trumped. It's being trumped by all of those other variables that are just more important to the outcome that we're trying to assess. So when you kind of think about it, it may be impactful when you're just looking at violent crime in relationship to jail populations, but when you're taking into account all these other factors like these healthcare costs or the number of mentally unhealthy days that people are reporting or other mental health infrastructure, those are just so much more important that they're just kind of washing away any kind of impact that the violent crime would be contributing to that outcome measure.
So we did have so it's relativity, right? How much of the variance can be explained by violent crime as compared to other things. Although Donna Harrison comments that it could also be that some of the violent offenders have been sentenced and then are moved on to a state prison system. And so that may be something to think about. Jennifer, I think you wanted to add something here.
Yeah, I mean, I said I think that can explain part of it, but a lot of the jail population, depending on the jail, is pretrial, and in the county I'm in, actually more than 90% of the jail population is pretrial, and most of it, folks held in jail, are for violent offenses. So I think it's probably a mixture of a lot of things. But I think some of it is just having somewhere else to take people. So if you have someone who was clearly mentally ill at the time of their crime or clearly addicted or whatnot, you have somewhere else to take them other than the jail. Because sometimes, at least in the communities I've been in, the police take people to jail sometimes when they just don't know where else to take them. And so there's absolutely people that need to be in the jail, but there are also people who there wasn't another good place for them.
Right.
Yeah, and as Alex mentioned, what we are suggesting is that in the presence of the health-related and mental health and demographic variables, the violent crime rate is not significant anymore. So it's while we're accounting for a lot of health services and mental health service, like mental health providers that they can be sent to, then this is not significant anymore, especially predicting the jail population.
Yeah, and I will say this is the world according to me, right? But it's really interesting because I used to live on the East Coast, and I worked in a couple of states that were among the lower incarceration rates in the country. I now live in Michigan, which is in the middle, and then there are states that have much higher incarceration rates than Michigan, and by multiple times, right? And there doesn't seem to be a strong correlation between the crime rate and how much at least states or counties, use incarceration, and internationally that's also the case. So it really does sort of raise the question then, do we need to use incarceration as much as we do, or what are the other options, or are there options that are less expensive? Because actually it takes, it's depending on the state, it's what, $30,000 a year to incarcerate a man and more for a woman. So it's interesting going from state to state, because even like crimes that somebody would, drug crimes, for example, that someone might do 6 months for, where I used to live, people can do 8 years for here. And so it's really, really not equal across the states. It's kind of interesting.
Yeah, well, that's the perplexing part that people have. We have one hand raised in the attendees, or two hand raised. Ben, can you see that?
Yes, why don't I allow that person to talk?
Okay. I think there's two people. Yeah. So Kristen Doyle, I think we unmuted you so you could raise your question or have your comment. So we do have in the Q&A, we have a comment from Jackie Mitchell, which says, our current problem isn't funding, but the lack of workforce, specifically mental health and psychiatric workforce. Professionals do not want to work in the public mental health anymore and being siphoned off by private clinics, or they're simply not returning to the workforce. We have 2 jail mental health positions that have been vacant for a long time, one for over a year, despite a wage hike. Diversion from intercepts, in other words, the sequential intercept model, is difficult to do without a workforce. And Jackie states that she believes that this is an issue throughout the United States. Obviously, Jackie, this is an issue in terms of having a sufficient workforce. I think sometimes it also, well, I know sometimes it depends upon your state in terms of who is certified or can be certified, whether social workers, counselors, psychiatrists, psychologists are included in the workforce. In a lot of countries, they use paraprofessionals, peer navigators, or community residents who have some training to at least deal with people with more than mild mental health issues. And that's, a strategy that we haven't really selected here in the US, although we do use some peer navigators or community health workers. But this is an area, like many professions, where we're starting to think about how to use different types of staff to really deal with the high demand when we don't necessarily have the sufficient workforce. I don't know, Jennifer, if you want to add to that.
Yeah, I guess I agree. It is a huge problem, and a lot of the things I've ended up trying as a researcher have been to see, how well can we train other folks to do this, at least some of this work, to pick up some of the tasks. I know, some states have, or areas have grants to try to at least keep physicians there. But I mean, I guess I agree. Yeah, that's a huge problem. I was just making a note to myself about what can we do about that.
Yeah, I mean, we know it's a huge problem. And, of course, part of the issue is also an issue in terms of compensation, because, people who work in mental health systems and also substance abuse systems tend to be at the lower pay grade. So I think this is also an area, if you look at some of the new funding that's coming out, those are all for some enhancements. But I do encourage people to really look at some of the peer navigators or, some of the community health worker models that can actually help supplement in this particular arena. I think part of our study, to be honest, is to draw more attention to the whole workforce issue, because, you can't deal with just medications for dealing with mental health issues. And so, we're hoping to elevate some of these discussions.
Yeah, and I was just going to notice what Kristen Doyle just said in the panel. It sort of like echoes. I mean, I completely agree. She said, was just going to mention that I live in California in a small rural community where folks go to jails. We don't have anywhere else to send them. Also, they call behavioral health to help when they get people in all sorts of need, as we're the ones who know how to refer people to other resources if we're not the right fit. And so that's completely true. Like, I live in a probably I would call mid-sized county now, but I was working with the jail. We absolutely get people with dementia who were driving the wrong way down the street, who have their dementia so bad that the jail can't really manage them, but they technically committed a crime, or people with developmental disabilities, which the jail isn't really appropriate, but there isn't a place to take them. And so I think in smaller communities, that's even more of a challenge for sure. And I think part of what we and a lot of you are trying to do is to help people who don't work in this area understand that it's really about that, and that if they want to invest in their communities, that and even reduce the cost of the jail to invest in some of these community services. But it's hard, I think, for people to get their heads around that sometimes.
Yeah, and particularly as Niloofar said, we have in our study sample, we have a number of jurisdictions that are considered small, having population sizes under 250,000. But we actually have quite a few that are under 100,000. And some of the things that we're learning in the survey is the degree to which people basically have staff or facilities that serve more than one county. And that being a technique that's kind of trying to address the workforce issue, but also allow for sharing of resources. So these kind of techniques or strategies is what we're trying to learn about in our survey overall. And that's why we're doing this, is because we think, well, we know that people are very creative at various agencies. And if we could learn more from some of the strategies, then it could be helpful to others as they're thinking about what they can actually do in their own jurisdiction.
Yeah, that's what I was just going to say, is that part of what we're trying to do is identify what they call positive deviance, right? The small counties or whatever that were really able to make it work, and how did they do that? And then help advocate for the policy pieces needed. I mean, if I had a wand and could change the world, I'd decarcerate half the people and double the money, or triple or quadruple for community mental health. But, I guess we're looking for how counties and how various people are able to advocate for the needed policy changes.
So Kristen also mentions that in her role, she supervises the behavioral health treatment courts, and she works closely with the jail, the district attorney, and she's a therapist also. wearing many hats there, Kristen. And that, you have to teach a lot of people about mental health and substance use, and what are some of the other options that might exist besides jail and prisons. But of course, not all counties have mental health treatment courts. Not many counties have actually problem-solving courts. But, you've mentioned here, which is, an important part, is expanding the education so people understand what is effective services, and treatment services. So are there other comments or questions from our panelists or anyone in the audience? So our next webinar is scheduled for August 4th. We actually sent out the login at the same time as this webinar. And we're going to be talking about the feedback report that we are going to be providing for those people who complete the survey or the interview. And the purpose of the feedback report is actually something that you can use in your county to try and elevate discussions about, what sort of needs are there, what are some of the other options that exist, and also, if funds do become available, like they are right now because of some of the federally funded, then, what are some of the resources? Alternately, of course, you could use this feedback report as a way to share with your county commissioners or your planners to talk about how to grow different types of services, particularly evidence-based services in your community. So please stay tuned for August 4th. And we thank everyone for your participation today. We thank folks for their comments. We thank Niloofar and Alex for the great presentation and hard work. And you'll be receiving a certificate from us. And please let us know if you have any questions. Thank you.